My name is Leslie Spencer, and this video is part of a series in Strong, Built, and Beautiful for women who've had breast cancer surgery and breast cancer treatment. The topic of this video is how to increase your flexibility and your range of motion after you've had breast cancer surgery. It's common for women after having lymph nodes removed and or having a mastectomy to lose a lot of their flexibility and range of motion in their shoulders. In fact, if you don't start stretching right away, even the day after your surgery, you may find that you can't raise your arms above your shoulder level without having a lot of pain. The day after my mastectomy, the nurse came into my hospital room and she had me do an exercise that she called walking my fingers up the wall, where I would stand close to the wall and I would walk my fingers as high as I could in an effort to extend my arm as far as I could go. I did both arms several times a day, every day after my surgery. That helped a lot, but I still found about a month after my surgery that it was hard for me to pull a shirt over my head, that kind of extension of my arms caused me a lot of pain and it was just very difficult for me to do. So I asked my breast surgeon for a referral to a physical therapist who works with breast cancer patients. And it's important that you get a therapist who's certified to work with breast cancer patients. Not all of them are, and you want somebody who has that specific expertise. The woman I worked with helped me a lot. She did 3 things for me. First, she helped me get fitted for a set of compression sleeves, and I talk about that in one of the other videos. Second, she taught me how to do a self-massage technique that reduced the swelling in my arms and helped minimize lymphedema. And that's a worthwhile technique to learn too. The third thing she taught me is what I want to show you in today's video, and it's a series of simple stretches I call the door frame stretches because you do them in a door frame. And you can do them throughout the day. I tried to do them about 4 times a day in different door frames in my house, and they look like this. You start by raising your hands above your head as high as you can and hook your fingers over the ledge of the door frame if you can. You drop down slightly, you can hang from the door frame, stretching your arms, and hold each stretch for about 10 seconds. Then you bring your arms out in a V shape. Still the arms are straight, elbows are not bent, and you gently lean forward, pressing into the stretch, feeling your shoulders roll back as much as you can. At first, this is going to hurt a little bit, and you're not going to be able to go very far. But if you breathe and gently work into the stretch and hold it for a few seconds, you'll find that your body can start to relax into it, and that's where you're going to see increases in your flexibility. Drop the elbows down to shoulder level, and again, press forward gently, relax into it. See if slowly you can increase your flexibility and increase the stretch. Drop your elbows down below shoulder level, and again, gently press, stretch forward. Hold it for about 10 seconds. Then you can step away from the door frame a little. Your palm is flat, fingers are down, and the arm is straight from the shoulder. And you just lean into it a little bit, pressing the arm as flat as you can against the door frame. You can even angle your body a little bit and turn away. That will increase the stretch. At first, this might be more than you can do. It might be too painful for you, but try and see if you can increase a little bit each time. You try the other side, same thing. Now, we've always been taught that pain in exercise is a bad sign, and that's true. You want to be careful about doing anything that inflicts pain. But I will tell you that in order for these stretches to be effective, you're going to have to feel a little bit of discomfort. You're going to have to push each stretch just a little bit more than you think you can if you want to get that range of motion back. Another stretch you can do is put your hand on your hip, roll your shoulder forward a little, and take your opposite arm and gently press forward on your forearm. This is great for your back, across your upper back. You can do the other side. Hand on your waist, just above your hip. Gently hold the forearm, and you feel yourself pulling and rolling the shoulder forward just a little bit. You can also take your arm, place it behind your back, and press forward. I would do each stretch. Try the other side. Gently press forward. And these are the stretches. It takes just about 8 to 10 minutes to go through the whole series. I recommend about 4 times a day if you can. And I encourage you to do it because I think it will make a big difference in regaining your flexibility, your range of motion, and your overall comfort. Okay, good luck with your stretching.